Have you ever noticed that some men seem almost mesmerized by one very specific form of intimacy? The way they approach it, the quiet focus in their eyes, the tenderness in their hands, it's not casual. It's devotion. And if you've ever wondered why so many men crave this particular connection, or why they love to show affection in ways that might leave you surprised, today's conversation will change how you see both him and yourself. I'm Dr. Lisa Perriera, a board-certified gynecologist with over 30 years of experience helping women restore confidence, circulation, and intimacy after menopause. And before you decide that this topic isn't for you, stay with me. Because what I'm about to share isn't just about physical pleasure. It's about emotion biology and the quiet way a man's desire can actually help you reconnect with your body and awaken parts of yourself you thought had gone silent. Most women over 50 were never taught to talk about intimacy openly. You were told to be modest, to keep those feelings private, to focus on everyone else before yourself. And yet, deep inside, a small part of you still longs to feel wanted, to feel seen, to feel alive again. The problem is, life has changed. Your body has changed. And sometimes you find yourself wondering, does he still see me the same way? Can I still feel the same spark I once did? Here's the truth that few women ever hear. Many men are not drawn to this act of intimacy for selfish reasons. They are drawn to it because it allows them to express love and devotion in a way words never could. When a man desires to kiss you, there he isn't just chasing pleasure. He's trying to give it, to prove to himself and to you that you still matter, that your body still has power, and that he can still make you feel beautiful. You may not have realized this, but the part of your body he's drawn to is one of the most complex and sensitive systems in all of human anatomy. It contains thousands of nerve endings, all designed to send signals of pleasure, relaxation, and connection directly to your brain. That reaction releases hormones, oxytocin, endorphins, dopamine, that build trust and emotional safety. So when he goes there, what he's really doing is building a bridge, not just between your bodies, but between your hearts. But there's something even more profound happening beneath the surface. After menopause, blood flow to that area naturally decreases. Tissues become thinner, drier, and less responsive. And when that happens, many women unconsciously pull away from closeness. The irony is that gentle, loving stimulation, the kind that focuses on giving rather than performance, can actually restore that circulation and awaken natural lubrication again. It's nature's own way of healing itself through connection, through affection, through love. I've seen this countless times in my clinic. A woman in her 60s or 70s comes in embarrassed, convinced her intimate life is over. Her husband has stopped trying, she says, or maybe she's the one who pulled away first. But when I help her understand that her body still holds that capacity for pleasure, and that her partner's desire is not judgment, but devotion, something shifts. Her eyes soften, her voice steadies. She begins to see herself not as a woman past her prime, but as a woman entering a new chapter, one where love is slower, deeper, and far more real than it ever was before. So before we go any further, I want you to take a deep breath and let that truth settle in. Your body is not broken. Your desire is not gone. And your partner's longing is not something to fear. It is something to understand, to appreciate, and perhaps to welcome again. Because when you allow that connection back into your life, you're not just giving him something, you're giving yourself permission to feel again. And in a moment, I'll explain why this single act, often misunderstood or dismissed, might be one of the most powerful ways to restore your confidence, your connection, and your vitality after 50. But first, I want to hear from you. Do you believe that intimacy deepens with age or fades? Leave your thoughts in the comments below, and let's explore this together. For many women over 50, the greatest barrier to intimacy isn't physical at all. It's mental. It's the quiet voice that says, "I'm not desirable anymore." I've heard it whispered in my office hundreds of times, usually by women who once felt confident in their own skin, now unsure whether their partner still truly wants them. And often that doubt grows into avoidance, not because they don't love him, but because they no longer feel worthy of being desired. Let's talk honestly about this, because the truth is, intimacy after menopause can be even richer than before, but only if you stop believing the myths that keep you disconnected. I've seen 3 patterns over and over again, and they all lead to the same place distance where closeness could have been. The first mistake is believing that age automatically takes away your sensuality. Many women assume that once the hot flashes begin, the romance ends. They tell themselves, "That part of my life is over." But the body doesn't work that way. According to the Mayo Clinic and the Cleveland Clinic, while estrogen levels decline, the brain's capacity for pleasure touch and bonding remains fully intact. The nerve endings that once responded to touch are still there. They just need consistent circulation and stimulation to awaken again. When you close yourself off thinking you've aged out of intimacy, your brain begins to believe it too. But when you allow gentle connection, when you say yes again, your body remembers. Every cell that once responded to touch is still capable of joy. The second mistake is thinking your partner is judging you. I remember a woman named Elaine, 62, who came to me with tears in her eyes. "Doctor," she said, "I can't let my husband see me anymore. My body looks different, I feel dry, and I'm afraid he'll notice." But when I met her husband later, he was desperate not for a perfect body, but for closeness. "I just want her to let me love her," he said quietly. That broke my heart, because it's a story I hear so often. Men in long marriages don't crave perfection, they crave connection. They want to feel useful, wanted, trusted. They want to know that their touch still matters. When you pull away because of self-consciousness, he doesn't feel relief. He feels rejection. And rejection, even when unintended, builds invisible walls over time. The third mistake, and perhaps the most painful, is treating intimacy like an obligation instead of an opportunity. So many women approach it as something to get through, or worse, something to avoid. But intimacy after 50 isn't about performance. It's about presence. Your body may move slower now, but it also feels deeper. The sensitivity you think you've lost hasn't disappeared. It's simply waiting for safety and patience to return. The more you rush, the less your body opens. But when you slow down, when you breathe, when you allow yourself to receive, instead of perform, your body responds in extraordinary ways. And here's something most people don't realize. When you allow your partner to connect with you through touch and oral affection, it doesn't just spark pleasure. It increases blood flow, strengthens pelvic muscles, and helps maintain the very tissues that time tries to weaken. It's nature's way of saying, use it or lose it. Every moment of gentle stimulation signals your body to send oxygen and nutrients to that region, something no supplement can fully replace. This is why I tell my patients that physical intimacy after menopause isn't just emotional, it's medical self-care. But let's be real. Knowing this doesn't automatically erase the fear, the dryness, or the doubt. Many women tell me, "Doctor, I understand what you're saying, but it still feels uncomfortable." That's because the brain and the body are deeply linked. If your mind is tense, your body will be too. The key is to retrain, both slowly, gently, with compassion. To see this act not as something shameful or youthful, but as something healing, sacred, and yours to reclaim. So if you've ever hesitated, pulled away, or told yourself that pleasure no longer belongs to you, I want you to pause for a second. Ask yourself this. What if saying yes again wasn't just about him, but about you? What if receiving could actually make you feel more alive, more confident, more connected, not only to your partner, but to yourself? because that's exactly what I've seen in my patients. Women who believed their intimate life was over rediscovering sensation, softness, and even joy they thought had vanished forever. All because they chose to open not out of duty, but out of curiosity and self-love. And in a moment, I'll show you how that happens, not in theory, but biologically. The surprising science behind why this one act of intimacy can rejuvenate your body, balance your hormones, and even calm your nervous system in ways most women never imagine. You'll see why, far from being just physical, it's one of the most powerful forms of healing you can experience after 50. But before we move forward, I'd love to hear from you. When it comes to intimacy, what do you think holds most women back? Fear, shame, or lack of desire? Leave your answer below, because your voice might help another woman find her own again. If you've ever found yourself thinking, I want to feel close again, but I don't know where to start, you are not alone. Reconnecting with your body after 50 isn't just about physical readiness, it's about emotional permission. It's about remembering that your body still belongs to you and it still deserves care, attention, and tenderness. So let's talk about what that actually looks like. When I work with women in their 50s, 60s, and even 70s, I often begin with one simple truth. The body responds best when it feels safe. No matter how loving your partner is, your body cannot open if your nervous system is locked in tension. And for many women, years of stress, hormonal shifts, and unspoken fears create that tension without them realizing it. The first step isn't technique, it's relaxation. One small daily practice I often recommend is what I call gentle reconnection. Each night before bed, take a few minutes alone. Breathe deeply. Place your hand over your lower abdomen and simply notice your breath moving there. This isn't about arousal, it's about awareness. When you learn to feel your body again, your body learns to trust you again. Over time, this small ritual begins to awaken circulation in the pelvic region naturally. According to research from the National Institutes of Health, mindful breathing increases blood flow to the pelvic floor by up to 30%, which helps restore the body's natural lubrication and sensitivity. You don't need supplements or fancy creams, just presence. The second step is rebuilding circulation and tissue health. After menopause, declining estrogen can cause thinning of the vaginal walls, making intimacy uncomfortable. But that doesn't mean it's over. Studies from the Cleveland Clinic show that gentle stimulation, especially through affectionate touch and oral attention, can increase oxygen and nutrient delivery to those tissues. This helps them stay supple, responsive, and alive. It's a natural, body-led form of therapy. In other words, your pleasure is your medicine. The very act of receiving love nourishes the same parts of your body that time has tried to quiet. But how do you start if it's been a long time? Start small. Connection doesn't have to begin in the bedroom. It can begin with conversation, with laughter, with a hand resting gently on yours. Touch his shoulder when you walk past him. Sit closer on the couch. Allow small physical moments to remind both of you that affection still lives here. And when you do begin exploring intimacy again, take your time. There is no rush, no pressure, no finish line. The goal isn't performance, it's connection. The more you allow yourself to feel safe, the more your body will begin to remember. I often tell my patients, you cannot receive pleasure if you are holding your breath. And most women don't even realize how tense they are. So as you explore closeness, focus on breathing. When your partner touches, you breathe out slowly instead of tightening. That single act signals to your nervous system that you are safe, that this is welcome. And when your body believes it is safe, everything changes. Your muscles relax, blood flow increases, and sensitivity naturally heightens. This is the foundation of pleasure after menopause, not hormones, but safety and trust. Another key step is preparation. Many women worry about cleanliness, scent, or appearance, and that anxiety blocks connection before it even begins. Remember, preparation isn't about perfection. It's about peace of mind. Take a warm shower. Use a mild pH-balanced cleanser. Maybe add a drop of natural oil like coconut or vitamin E if dryness bothers you. Dim the lights, light a candle. Create a space that feels calm and comforting. These are not superficial gestures. They tell your mind, I'm ready to receive. And that readiness can completely transform the experience. And yes, for many couples, oral intimacy can become one of the most healing experiences of all. When your partner's attention is focused entirely on you, and you allow yourself to be still, to breathe, to receive, your body begins to reawaken. The combination of increased circulation, hormonal release, and emotional connection forms what I call the triple restoration effect. Physically, it restores blood flow and lubrication. Emotionally, it rebuilds trust and vulnerability. Psychologically, it tells your brain that you are still worthy of pleasure. That message alone can change everything about how you move through the world. I remember one woman, 68 years old, who came back 3 months after trying these small steps. Her eyes sparkled as she said, "Doctor, I didn't think it was possible to feel this alive again." She wasn't talking about sex. She was talking about confidence. The joy in knowing that her body could still respond, that she was still a woman capable of desire and joy, not just a patient managing symptoms. That's what I want for you too. Because once you rediscover that feeling, it ripples outward into your mood, your energy, your health. You sleep better. You smile more. You feel more at ease in your own skin. And the beautiful part, your partner feels it too. Connection creates vitality for both of you. In a moment, I'll share a story that illustrates this transformation in the most touching way. A couple who rediscovered passion and purpose in their 70s, not through perfection, but through patience, vulnerability, and love. Their journey might just remind you that it's never too late to begin again. But before we go, tell me this in the comments. If you could change one thing about how you feel during intimacy, would it be more comfort, more confidence, or more connection? Your answer might be the first step in your own restoration. I'll never forget a couple I met years ago, David and Marjorie. They were both in their 70s when they came to see me. Marjorie was quiet, almost apologetic, as she explained, "Doctor, I think we're just too old for all that now." David sat beside her, eyes down, his hands folded in his lap. I could feel the ache between them, not anger, but distance. The kind that builds slowly when two people love each other deeply, but stop touching, stop trying, stop believing that closeness still belongs to them. As we talked, Marjorie admitted something she had never said out loud before. "I don't let him go near me anymore," she whispered. "I'm embarrassed. Everything down there feels different, and I'm afraid he'll notice." Her eyes filled with tears, and then, in a voice barely above a whisper, she said, "I miss the way we used to be." That moment changed everything. I looked at her and said, "What if your body isn't broken? What if it's just waiting to be reminded how to feel?" Again, I explained what we now know through science, that intimacy, especially oral affection, can increase blood flow, strengthen tissues, and release oxytocin, the same hormone that bonds a mother to her child. That hormone doesn't stop working at 50 or 60. It's still there, waiting to reconnect you. I gave them a few gentle steps, simple breathing, soft lighting, no goals, no pressure, just exploration. I told David, "Your job is not to perform. It's to be present, to give, not to take." And I told Marjorie, "Your only job is to breathe and allow." 2 months later, they came back for a follow-up. I barely recognized them. Marjorie's face glowed with color. She laughed more. David held her hand the entire time. She looked at me and said something I'll never forget. "Doctor, I thought that part of our marriage was gone forever." But it wasn't gone, it was just asleep. Her words hit me deeply, because that's the truth so few people ever hear. Pleasure doesn't disappear with age, it simply goes quiet when neglected. And when it's awakened again, it doesn't return as it was in your 20s. It returns softer, deeper, and infinitely more meaningful. I often compare it to a garden. After a long winter, the soil looks dry, lifeless, even hopeless. But underneath, the roots are still alive, waiting for warmth, attention, and water. When you begin to tend to it again, not forcefully, but gently, it comes back to life. Intimacy is the same. The soil of your body may feel dormant, but the roots of desire, connection, and tenderness are still there. They've been there all along. For Marjorie, it wasn't just her body that changed, it was her confidence. "I feel like myself again," she said, "not a wife doing her duty, but a woman being loved." And David added quietly, "I feel like I have my partner back." That's the kind of healing intimacy can bring not only for the body, but for the soul. And I want to pause here for every woman watching who has ever felt like Marjorie. If you've thought, "My body is too old, too dry, too changed," I want you to know you are not past love, and you are not past pleasure. Those parts of you were never erased. They're just waiting to be seen again, to be touched again, to be trusted again. One of the most powerful things I've learned in decades of practice is that the female body remembers. It remembers kindness, safety, tenderness. It may take a little time, but once you start giving yourself permission to receive, again, everything begins to flow. Your blood, your hormones, your emotions. They all respond to the message, "I am safe to feel again." And here's something beautiful I often see in couples who rediscover intimacy in their later years. The laughter comes back. The small gestures return. They begin to hold hands again at the dinner table. They make eye contact longer. It's not about sex, it's about life flowing back into their relationship. The more connected you feel physically, the more alive you feel emotionally. So if you've been telling yourself that time has passed, I'm here to remind you it hasn't. It's waiting for you to give yourself permission to open that door again. Because the real secret isn't about what your partner does. It's about how you allow yourself to receive. The moment you decide to soften, to breathe, to trust the years between you, begin to fade. The body may have aged, but love doesn't age, it ripens. And in a moment, I'll help you bring all of this together. I'll share the small but powerful habits that keep intimacy alive long-term. The little daily rituals that help you maintain confidence, comfort, and closeness well into your 70s and beyond. But before we move to that, I want to ask you something personal. Do you believe it's possible to feel passion again after 60? Or do you think that chapter is closed? Share your answer in the comments. Your story might just inspire another woman to believe in her own again. When you really think about it, everything we've talked about today comes down to one simple truth. Love doesn't fade with time. It matures. It deepens. It becomes something far richer than the early spark of attraction ever could be. You've seen that in every part of this conversation. The science is clear. Your body is still capable of feeling, of responding, of coming alive again. The emotional truth is even stronger. Your partner's desire isn't about youth or appearance, it's about connection. And the spiritual truth is perhaps the most beautiful of all intimacy at its core, is not about performance. It's about presence. We began this journey by asking why men are drawn to such an intimate act. And now you know it isn't just about lust or curiosity, it's about devotion, about the deep instinctive wish to make you feel seen, cherished, and alive. For a man who truly loves you, giving pleasure is his way of saying, "You still matter to me. You still move me." When you understand, that you stop seeing it as something to be embarrassed about and start seeing it as a gift. Then we explored the quiet barriers that hold so many women back, the fear of aging, the worry of being judged, the belief that your body is somehow less worthy now. But those are illusions. The truth is, your body has carried you through decades of life. It deserves to be honored, not hidden. You deserve to be touched with love, not hesitation. And when you begin to let yourself receive again, something extraordinary happens. Circulation improves, tension melts. Hormones like oxytocin and endorphins rise naturally, calming your nervous system and rekindling your sense of joy. This is not fantasy, it's biology. Intimacy in its healthiest form truly heals. But beyond the science, there's something even more profound. Reclaiming intimacy after 50 is an act of courage. It's the moment you stop living by the old rules that told you to shrink to hide, to accept silence where love once was. And you decide instead to open, to trust that your body, even with its changes, still deserves tenderness. I want you to remember the story of Marjorie and David. They didn't find magic in a pill or a procedure. They found it in patience, in presence, in rediscovering each other's touch. That's what I want for you. Not perfection, not performance, just connection, the kind that fills a room without words. And here's how you keep that connection alive. It's not complicated. Start small every day. A gentle touch on the shoulder, a shared laugh at breakfast, a quiet thank you before bed. These small gestures feed the emotional bond that makes intimacy possible. Keep your body cared for, stay hydrated, move regularly, and practice mindful breathing. These simple acts support the very systems that fuel circulation, sensation, and vitality. Most of all, talk. Speak your fears, your hopes, your needs. Communication isn't awkward, it's love in its purest form. When you share openly, you give your partner the chance to love you better. And when he listens with patience and gentleness, the years between you begin to fade. Many women tell me, "Doctor, I wish I'd known this sooner." But I always remind them, so long as you're breathing, it's never too late. The body may age, but the capacity for intimacy never expires. It simply waits for your invitation. So tonight, I want you to do one small thing. Look in the mirror and say softly, "I am still a woman. I am still worthy of love." You don't need anyone else's permission to believe that. The more you say it, the more your heart will begin to remember. If this message resonated with you, take a moment right now to subscribe and join our community. Here we talk about the things no one else does, the truths, the struggles, and the quiet victories of women over 50, reclaiming their confidence, their bodies, and their joy. Share your thoughts below. Have you ever rediscovered something beautiful about yourself in midlife? I'd love to read your story. Because the truth is, you are not done. You are not invisible. You are still capable of being loved, desired, and celebrated in every possible way. Your body is not the end of your story, it's the beginning of a new one. So let me leave you with this. Intimacy is not lost with age. It deepens with understanding. It grows with kindness. And it thrives in the quiet moments when you allow yourself to be seen exactly as you are. And before we close, let me remind you this video is for educational purposes only. It does not replace medical advice. Every woman's body is unique. If you are experiencing pain, significant changes, or have personal concerns, please consult with your healthcare provider. Your well-being deserves personalized care.